Healthcare systems depend on how much they cost and how effective they are. And I think our stakeholders, who include the patients, they include the families, the carers, they include the academics, researchers, doctors, nurses, social care workers and so forth, and all the people who supply other services like transport and benefits and so on, housing, which make for good health. If they work together more, then I think they will begin to produce more sustainable healthcare. If you take somebody who's had mental health problems and they've been in hospital for a time and they come out of hospital, they're discharged, and they are placed in housing on a high-rise estate, tower blocks, and without real sort of neighborhood communities relations, perhaps frightened by dangerous dogs and dark alleyways or whatever, then that's doing nothing for the health of that individual. If you place them in a more community-friendly environment, then that environment will contribute to their recovery. And so the whole investment in the health process will become more sustainable because that person's health is going to be more sustainable. Now, if you just take that example and spread it right across the field, I think you can see that we need to think the whole picture. And that means, in a way, coming to the patient as the center of our policy making and saying, what does that patient need? And it's not just a pill, it's not just half an hour's therapy, it's not just a holiday. It's a combination of factors and a combination of benefits to that individual, which will include housing, transport, communication with neighbors, friends, maybe activities in the sporting or social and so on, and all those things. And I don't think, on the whole, we do enough to think of the whole person. If I think of somebody aging, and I've seen them in my own family, their health, their mental health and their physical health is not helped by the fact that there is no ability in our system to contribute one of the elements which would make for a much better quality of life, which is the communication. It's the ability to help somebody to reminisce, to talk, to communicate. Maybe we have hearing problems, maybe they have sight problems, but if they communicate with other human beings, then they spark a quality of life, physical and mental, which is worth considering.